Diabetes mellitus. Type 1 diabetes. In people with diabetes, there are two main types. 1. Type 1 diabetes. Type 1 diabetes is usually diagnosed in children and young adults and is often referred to as juvenile diabetes. This type of diabetes occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin, called beta cells. As a result, the body is unable to produce insulin and needs to receive it through injections. Diabetes mellitus is a chronic metabolic disease that affects the way the body processes glucose, a type of sugar, which is the body's primary source of fuel. Normally, glucose enters the bloodstream after we eat and is carried to our cells where it is used for energy or stored for later use. To enter our cells, glucose needs insulin, a hormone produced by the pancreas. 2. Type 2 diabetes. This is the most common form of diabetes and occurs when the body becomes resistant to insulin or when the pancreas doesn't produce enough insulin to keep blood glucose levels within a normal range. Type 2 diabetes is often associated with obesity and is more common in older adults, although it is also becoming more prevalent in younger populations. Both types of diabetes can lead to serious health problems such as heart disease, stroke, kidney disease, blindness, nerve damage, and amputations if not properly managed. Treatment for diabetes includes lifestyle changes such as healthy eating, regular physical activity, and maintaining a healthy weight, as well as taking medications as prescribed. Regular monitoring of blood glucose levels is also important to help prevent and manage complications. Type 1 diabetes mellitus. Type 1 diabetes mellitus, also known as insulin-dependent diabetes or juvenile diabetes, is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone that regulates the amount of glucose, sugar, in the blood. In people with type 1 diabetes, the body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin, called beta cells. As a result, the body is unable to produce insulin, which is necessary to help glucose enter the cells and be used for energy. Type 1 diabetes usually develops in childhood or early adulthood, but can occur at any age. The exact cause of type 1 diabetes is unknown, but it is believed to be a combination of genetic and environmental factors. Symptoms of type 1 diabetes include frequent urination, excessive thirst, unexplained weight loss, fatigue, blurred vision, slow healing cuts and bruises, and frequent infections. Treatment for type 1 diabetes involves daily insulin therapy, which can be given through injections or an insulin pump, as well as careful monitoring of blood glucose levels. A healthy diet, regular physical activity, and stress management are also important components of treatment. It's important for people with type 1 diabetes to work closely with their healthcare team to manage their condition, prevent complications, and maintain good health. Complications of uncontrolled type 1 diabetes can include heart disease, stroke, nerve damage, kidney disease, eye damage, and amputations. Type 2 diabetes mellitus. Type 2 diabetes mellitus is a chronic metabolic disorder characterized by high levels of sugar, glucose, in the blood. It is caused by the body's inability to produce enough insulin, or by the body's cells becoming resistant to the effects of insulin. This leads to an increase in blood glucose levels and a range of associated health problems. Type 2 diabetes mellitus typically develops in adulthood and is often associated with obesity and a sedentary lifestyle. Other risk factors for type 2 diabetes mellitus include family history, increasing age, and certain ethnic backgrounds. The symptoms of type 2 diabetes mellitus can include increased thirst, frequent urination, blurred vision, slow healing wounds, and fatigue. In some cases, there may be no noticeable symptoms, and the condition may be discovered during routine blood tests. Type 2 diabetes mellitus is managed through a combination of lifestyle changes, such as healthy eating and increased physical activity, and medication. In some cases, insulin injections may be required. Regular monitoring of blood glucose levels is also important to help manage the condition and prevent long-term complications, such as heart disease, nerve damage, and kidney disease. Type 2 diabetes mellitus is a serious condition that requires ongoing management, but with proper treatment and self-care, most people with type 2 diabetes mellitus are able to live healthy, active lives.